Stye is a painful red swelling on the edge of the eyelid. These inconvenient pimples are quite common, and even though they are usually short-lived, have the potential to make your life miserable for about a week or so. Now, to find out why we get them and what can be done about the pain, we've invited Dr. Paulo into the studio. Paulo, Styes, I mean, it's something that a lot of people may have had as kids. I know I used to get them when I was a child, but they're not as common as we sort of might expect. But what are we talking about with a stye, and what causes a stye?
Yeah, all right. So a stye is an acute bacterial infection of the eyelid margin. There are two possibilities. You can have what is known as an exterior stye, so the infection then, or the abscess formation is on the follicle of an eyelash, where the eyelash comes out. You can have an interior stye, where the infection is on the meibomian gland, just on the inside of the eyelid, the glands that produce the oily substance that helps with the lubrication of the eyes and the formation of tears.
Right. What would the symptoms be of a stye? I mean, obviously at some point it's very obvious, but earlier on there might be certain telltale.
Look, it comes on very quickly, usually. All right, so there'll be a swelling. Sometimes the swelling can get to the size of a pea even.
Right.
There's pus inside, and often it's noticeable because there's a yellow tinge in terms of color as well. Depending on size, it can cause blurry vision. It can cause teary eyes as well. But it is not to be confused with something that looks similar called a chalazion, which is an inflammation of the same gland that produces that oily substance, but not an infection. Okay, so styes are infections, and they are brought on. You said you got them as a kid. That's the common, because as a kid you would rub your eyes with dirty hands all the time, for example, and you bring on the bacteria. Okay,
so just to go back to your point about the one being an infection and the one an inflammation, would the telltale sign be that yellowish color?
That's one of them, sorry. Yes, that's one of them. And the other one is what you said earlier, that a stye is very painful, whereas a chalazion is not painful.
Okay. So, Paulo, are there specific people who would be more likely to get styes or to develop styes?
Yes, so contact lens wearers, especially if they don't wash their hands for obvious reasons. It seems to be more common in diabetics and other patients that have diseases where the immune system is compromised. Okay. It is also believed to be more common in women because of makeup usage. All right. So basically, those are the main groups.
So, sort of joining the dots to some degree, it's a result of touching your eyes, introducing things into your eyes because you haven't washed your hands, or using makeup brushes or ends or whatever the case.
That's right. Yes, it's usually due to Staph aureus, which is a commensal. In other words, it's a bacteria that lives on your skin. Okay. So it's a matter of moving it to the right place, or you've picked it up somewhere else with your hands. Right. And then you scratch your eyes.
Okay. And what would be the sort of standard treatment for a stye? Because I mean, I've seen young kids who look rather distressed about the fact that they've got this massive big thing. But what do we traditionally do about styes, or do you wait for them to?
Yes, that's what you do. It's a self-limiting condition, meaning it comes and it goes. Usually, most often within a week, it's gone. All right. There is no evidence that antibiotics have any effect on it. Warm compresses are recommended, so a face cloth in warm water, and that will soothe the pain, basically. But it usually, in about a week, it goes away.
I remember as a kid when I used to get them, my mother would give me a gold wedding ring.
Yes,
rub it so it gets nice and warm.
That's an old treatment.
Very traditional.
If they get very large and bothersome, then you may have to go to an ophthalmologist who will do an incision and drain it.
Okay. And in terms of the time that they exist, I mean, is there a point at which you should really consider going to see a doctor, even if it's not necessarily at that point of being in need of a lancing?
Generally speaking, yes. If it's there for more than 2 weeks, I'd say definitely go see a doctor. Because between 1 and 2 weeks is the usual time, then it should go away, because your immune system deals with the infection. Right.
And in terms of the evolution of a stye, I mean, it starts as a stye. Can it develop into something that's more of a problem than a stye?
Not really. Cases where the infection goes to the socket, to the eye socket, are very, very rare. It can develop into a chalazion, so the gland can then become inflamed afterwards, not infected, or you can have a new stye in the same place.
Okay, so it kind of duplicate or replicates next door. So now, if we've got a stye, I mean, obviously you don't want to spread a stye because it is an infection of some kind. What precautions should we be taking to ensure that we don't become the host of a bigger plague?
The same as one usually should have done prior to the stye arriving. Good hygiene.
Okay.
So, keep not touching your eyes, keeping your hands washed, not sharing towels, for example.
Right.
You can also get it from sharing somebody else's towel.
Okay.
Because remember, situations can exist where you may have infected your eyes, but your immune system is strong enough and the infection actually doesn't develop to the point where a stye is noticeable, but you've used the towel while you had the infection, and that infection passes on to the next person that uses a towel whose immune system is not as tough as yours, and then that person develops a stye.
Okay.
So it's
And Paulo, how common are styes? I mean, we've had different experiences with them.
yes, in my clinical practice, they were not common. So I, for some reason, wasn't exposed to a lot of styes. I know colleagues who see styes every day.
Right.
So I think it's difficult to say.
Right, Paulo, so we have actually put into our Real Health Medicine cabinet today Similacin Stye Eye Relief, which is something that is quite unique because there aren't many apart from the antibiotics that are treatments for styes. What is interesting about this and makes it a worthwhile option to explore?
A number of factors. So as you say, it is the only non-antibiotic product that I'm aware of. The manufacturer is the Swiss company Similacin, and they've been around for over 40 years developing a range of homeopathic eye drops for various eye conditions.
Right.
So they are the #1 homeopathic range in Europe, for example. The product is made of 100% natural substances. The pH is the same as the pH of your eye. Okay. It can be used by people who wear contact lenses as well, although if you have a stye, you're probably not going to be wearing your contact lenses. All right. The dosage is 1 to 2 drops, 3 to 4 times a day. That's sort of the recommended dosage. Remember, it doesn't treat the infection. It helps with the symptoms. So it will reduce the pain, the irritation, while your immune system is dealing with it. But it is extremely effective.
Okay, fantastic. And it's, I mean, you mentioned if you've got contact lenses, you shouldn't necessarily, well, you can, but it's probably unlikely you will be using them. Is there anyone who should avoid using a product like this?
Not really. It's entirely natural. And remember, it's homeopathic principle, so the substances in there are diluted many times.
Okay.
And remember, the homeopathic principles works, for example, you take 1 part of a natural substance, you add 6 parts of water, and then from this you take 1 part and you add another 6 parts of water, and you might do that 12 times. So by the time you understand the dilution.
Minimal,
it's minimal.
Okay. And Paulo, where can we find this product?
I believe it's available in pharmacies and health shops.
Wonderful. Thank you so much.